Now, reload. We start putting some of these tissues through some active range of motion, and we build up the confidence and the tolerance to some of these loads or these stressors. Now, this is kind of like the little win stage. We're looking for little wins here, right? If you had a hard time just getting up and down off the chair, now we're looking for a very similar movement, but even less intense to go better and pain-free. So the key point of the reload is we need to be mobile where we should be mobile. Where we need to be mobile for a healthy back is through the upper back and the shoulders, through the mid back, upper back, and shoulders, and through the hips, okay? Our lower back, our lumbar spine sits right between those two things. So it would behoove us to get as mobile as possible between the upper back and the hips, all right? So this is where we're going to stop our screen share, all right? And I'm going to go full screen here. And what we're going to do is we are going to demonstrate a couple things here. So is everybody able to hear me, see me? Again, if you're on, I would greatly appreciate you letting me know that you can see and hear me in the chat. Beautiful. All right. Thank you, Michael. I appreciate it. Again, I am sorry for the technical difficulties. This is what happens when we are live on the internet. So the reload phase, right? What we're really going to talk about here is we're going to talk about how to induce some mobility through the spots where we should be mobile, all right? So we're going to be looking at mobility through the upper back and the shoulders, mobility through the hips, and then there is a little movement of the lower back, which is, if you think about the lower back here, there's this little arch, and we want to have the low back get comfortable with a little bit of forward bending and backward bending. Now, a lot of this stuff we're laying down, right? So the top three things that I'm going to show you for this mobility or this reloading stage is a little bit of hip mobility, a little bit of upper back mobility, and then some gentle kind of lower back range of motion options, all right? So I got a couple tools here all set for before our webinar. So first off, if you have a foam roller or something, we want to work on keeping our lower body nice and stable, and we want to work on mobilizing our upper back and our shoulders. So one of my favorite exercises is the open book. It's called the open book. So what I do is I get my top leg up on a foam roller. If you don't have a foam roller, it can be a basketball, a pillow, whatever you got to do. And I get my bottom leg straight out. And I take my hands and I stack them on top of each other. And we call this the open book. Because what I'm going to do is open the top half of my body. And I'm going to try to open my chest towards the sky. But I'm keeping this knee on the foam roller. All right? And I'm breathing. So we're going, 8 to 10 reps here. We're opening up and we're breathing. I'm trying to keep my lower body like a statue while I rotate that upper back and I open up the shoulders towards the sky. Maybe hold a breath or two at the end range. And then close it back up. And you would obviously do both sides there. If you feel any big differences side to side, make sure you let me know, or you might want to take note of that, okay? Differences side to side, rotationally through the upper back. The lower back will probably pay the price for that a little bit, so to speak, all right? The other thing that we really like for the hips, right? A lot of people that have a hard time with lower back problems, their hips do not rotate well, right? They're just not mobile. So they're really tight in the butt, they're really tight in the groin, they're really tight in the front. So one of the simplest ways to start with some of our hip mobility things is to get the feet nice and wide, right? Knees bent, feet flat. Get the feet nice and wide. This is not the most flattering shot of me here, but in the name of back pain relief, here we go. I'm going to windshield wipe my knees side to side, okay? So I'm keeping my feet right where they are, but I'm letting the soles of my feet come up, and I'm just rocking side to side here now, all right? Now, the key point here, this is simple but effective, because if I widen my feet, if I get my feet wider than my shoulders, and I drop my knees down, my low back and pelvis can rotate, but I'm trying to keep my ribs and my shoulders flat up above. So we're working side to side here, and we're breathing. Working side to side, and we're breathing. It's okay if your low back and your pelvis come with you, but we want those ribs and upper back staying flat to the ground. Okay? So that's a good hip mobility kind of reloading strategy. Now, reloading the actual low back. We're going to work on something called pelvic tilting here. And this is a very, very simple, very old school, very boring, mundane exercise. But we want that low back to tolerate bending forward and bending backwards. But we don't want to be doing this big, forward bend, backward bend while we're standing or weight bearing. So I'll show you this one from the side. What you're going to be doing here is you're going to be getting in this position again where your knees are bent. Now, sometimes it helps to put a folded towel under your low back or something like this. And I don't know if you're going to be able to see this too well from the camera. But what we're going to work on is from this position, I'm going to think about flattening my low back into the ground, right? So I'm rolling my pelvis. If you can see my belt buckle here, I'm rolling that towards my chin. And I'm actually trying to flatten my lower back into the ground. Now I'm doing that by using my abdominal muscles. So I'm crunching my abdominal muscles, or I'm rolling my pelvis back, but I'm not really pushing through my feet right now at all. And then I'm going to try to arch my back and lift off the ground. Now for some individuals, it may be more painful one way or the other. And I would argue that you just work the direction that doesn't hurt and actually feels like you want to do it more. And then the next day, try to come back and try that opposite direction. But this is just a nice little reloading strategy for that low back, okay? So if you're in the phase where right now you don't have access to somebody to do, deep tissue work, do dry needling, but you got to do something, you want to get some movement. Those are a couple really, really simple but effective reloading strategies, okay? Just some ways to get some range of motion going back through that spine and really focus on mobility where we need to be mobile.